Well, I'm finding that this is really a synergistic conference. I mean, Dr. Zielinski this morning, you're going to be hearing from speakers talking about glutamate and talking about imaging earlier, so I'm just excited to be here. How many healthcare providers do we have in the room? And how many attorneys? Don't be afraid to raise your hand. And how many survivors do we have? Great. And so I imagine many of you are looking for additional tools and resources to help your loved ones or your patients, your family members. Our brains are involved in everything that we do. Isn't that true? Our brains are involved in everything we do, and by improving the health of your brain, you can improve the quality of your life and your patients' lives. We're going to talk today about ways to improve the health of your brain through natural, effective treatments, as well as to assess the health of your brain and pick up brain injury that might have been missed by other means. Now, there's been millions of dollars over the past 5 to 10 years spent on natural treatments for brain injury. Why is this the case when we've actually reduced the death rate from brain injury from 50% down to between 20 and 30%? But that's not enough. We need to reduce the death rate even further, of course. And so we need to rethink the whole problem. We need to go back to the drawing board. I love this quote by Seth Godin, who says that back to the drawing board. Isn't the drawing board the place where all the best work happens anyway? It's not a bad thing. In fact, it's the entire point. We need to rethink what we're doing with brain injury. And even earlier today, we were talking about additional treatments I didn't know about, Dr. Zielinski, for example. There's a tremendous amount of research on natural treatments for brain injury. Now, here in the Northwest, we have some of the best neurosurgeons and their teams at OHSU, Harborview in Seattle, and these doctors have done tremendous work at improving the health and the lives of patients with brain injury. But we need to continue to look at other options. So when we think about the mechanism of brain injury, it's really a multifaceted problem. And the researchers at Stanford, there's actually an undergraduate student, Theodore Roth, who was fortunate enough to be involved in some research on mice. So they took mice and they implanted an intracranial microscope. So these poor little mice have got a microscope implanted into their heads, and then they give them a brain injury and they see what happens for minutes to hours afterwards. This is never before seen footage. And they're able to record this, and they saw the meningeal tissue that surrounds the brain gets torn and damaged. They saw inflammation. They saw reactive oxygen species. And reactive oxygen species are kind of like oxidation. So when you think about metal rusting in the rain, that's kind of what's happening with oxidation. It rips cells apart. It's very damaging. There's cell death, and there's decreased blood flow. So these are some of the pictures that they took before and after injury. And your astrocytes are your cells that are supportive, that are nutritive to the neurons. So on the left, the black lines we're seeing, those are blood vessels. That's healthy, normal tissue. On the right side, it looks like chaos in a way. There's a lot of damage. Now, what I love about this study is that they took it a step further. And after they had this very nice mechanism of brain injury, they said, okay, what can we do to help the brain? And they applied something called glutathione. And glutathione is your body's premier antioxidant. It's produced in the brain and the lungs and the liver. And it quenches free radical, this oxidative damage that we just talked about. And so the cells on the left, do you see those little they look like jellyfish. They're called jellyfish macrophages. And they're inflammatory cells. They're trying to mop up damage. They're swelling, trying to fill in space. On the right side, with glutathione, you can see they look like spindles, and that's more normal. Now, And on the left, without glutathione, these green dots are inflammation, neutrophils. And on the right side, it's much less inflammation with glutathione. Now I've got a video I'll try and play here for you. And we're going to see what happens second to second and over a sort of time-lapse photography of brain injury. And we're going to be looking at microglia. Oops, let's see here. Okay. So on the left is the brain injury, the right is glutathione, and you can see the jellyfish macrophages, and on the right it's fairly more normalized. It actually reduced, also on the left, again, microglia, sort of more chaotic on the right with glutathione, just remarkable difference. So you'll see the black line fill in on the lower screen, and that's what's supposed to happen. There's supposed to be separation there. And again, on the left, you'll see neutrophils kind of flood in. The neutrophils are the inflammatory cells trying to mop up damage. On the right side, there's not as much with glutathione. So the glutathione reduced cell death, if applied immediately, 67%. And if applied after 3 hours, reduced cell death 50%. That's a remarkable decrease in cell death. So I can imagine, like, on the sidelines after football games, they have buckets of glutathione, just dunk the players' heads in. So why would natural treatments be effective for brain injury? They match the multifaceted mechanism of damage. Natural treatments have multiple mechanisms of action as well, and that's why they fit together. Natural treatments such as curcumin have hundreds of different chemicals, and that's why they can match up with the mechanism of brain injury. So these are some studies showing that curcumin is a yellow spice from curry. It's what makes curry yellow. They took an extract of that and showed that it reduces inflammation and reduces swelling of the brain after brain injury. Same for fish oil. Omega-3 fatty acids also decrease swelling, decrease cell death, and actually help the brain and the neurons to grow, regeneration. I want to talk a little bit about this first nutrient. Yes, question? For curcumin, sure. And it's a great question, and you guys can ask questions as we go. Thank you. Question was dosages. So I'll go through some dosages here. And, it differs based on acute brain injury versus treating chronic brain injury, which is a little bit different. And we'll talk in a while about some specific nutrients that we use for some specific cases as well. But for curcumin, I'll use 500 milligrams twice a day. And of course, you want to work with your doctor on this if you're a patient or caregiver. But 500 milligrams twice a day. Omega-3 fatty acids need to be given in high doses, upwards of 5.6 grams a day is what we'll use. And these are large doses. And you think about your brain being 60% fat or more. And one of the components of fatty acids, there's DHA and EPA. That's a breakdown of fish oil. Those two structural components, especially DHA, is helpful for basically they're structural for the cell membrane of the brain. Acetyl-L-carnitine. So often in brain injury, it's a low brain energy state. There's folks are going to be tired, fatigued, not have enough firepower as far as sustained focus and concentration. And acetyl-L-carnitine is like energizing to the mitochondria. So if you remember from science class, your mitochondria are your cells, part of the cell that produces energy, actually. And acetyl L-carnitine energizes that part of the cell, so it increases cellular energy. And dosages will use upwards of 2,000 milligrams, which have been utilized at that level for depression as well.
How much for glutathione?
Glutathione is used topically, typically, and it's more experimental. So we'll actually use NAC, which is N-acetylcysteine, which is right there under antioxidants, because glutathione is an antioxidant. So N-acetylcysteine, or NAC, is a precursor to glutathione. So we can actually give that. And we'll use upwards of 2,000 milligrams. So I tend to use higher doses of these nutrients in particular. For reduced blood flow, we think about vinpocetine and ginkgo biloba. These are both herbs. And again, cell membrane damage, omega-3 and phosphatidylserine. Phosphatidylserine is a really cool nutrient that I use a lot of, and it's another structural cell membrane component. Specifically for memory, it seems to be helpful. And for dementia patients in particular, at least 300 milligrams need to be used.
What about giving it intravenously?
The question is, what about intravenous phosphatidylserine? I'm not aware of a supplier for that,
Okay.
but there probably is somewhere. You know, it'd be a useful intervention for sure. Another treatment that's maybe hidden right under our noses is progesterone for brain injury. Typically thought of as a female hormone, right? And when you think about when progesterone levels are the highest are in pregnancy for the fetus, which helps produce growth and protection for the developing fetus. That's exactly what we want to see happen after brain injury. We want to see protection, and we want to see growth of neurons. So progesterone, what does it do? It decreases swelling, decreases inflammation, oxidative damage, helps encourage growth of neurons. It's a very potent healing agent for men or women. Does it work though? Well, there's 300 preclinical trials, and preclinical trials are those done on animals. 300 preclinical trials showing it's effective for TBI. Then you go to phase 2, human studies. These are double-blind trials with brain injury patients and around 100 patients. So combining vitamin D with progesterone, this is a real key piece of it, is combining vitamin D with progesterone reduces death from 30% down to 13% in this study. So significant reduction. These are quite high doses of progesterone. However, there was a phase 3 clinical trial, which was a large-scale trial, 1,000 patients, and it showed progesterone was about equal to placebo. So it didn't show as a robust response. I think this study had some flaws. Insufficient dosing, wasn't combined with vitamin D, poor study design. I communicated with Don Stein, who's one of the PhD researchers for progesterone, who, he thought because there's so much evidence, we need to continue studying and not give up on this powerful nutrient. Again, we need to think about combining different natural treatments to match the mechanism of action, the multifaceted nature of TBI. Now, even the most effective treatments are not going to work if you don't have the right target. So this quote by Zig Ziglar, you can't hit a target you cannot see, and you cannot see a target you do not have. So at the Amen clinics, we look at the brain to assess which areas may have been damaged. What needs to be treated? Is there a brain injury? We have so many patients that will come through our doors who went to the emergency room. They had an MRI, they had a CT after an accident, for example, and they were told their scans were normal. However, they continued to struggle with problems, memory problems, or headaches for months, even years after. And so it's helpful to actually understand what organ you're treating. So we're going to be looking at some SPECT scans, and SPECT stands for Single Photon Emission Computed Tomography. And how we get the scan is an injection of a small amount of radioactive isotope, which then sits in the brain at the most active parts, and we get this nice colorful scan you can see up in the upper right. And so it's a functional scan versus an anatomical scan like an MRI or a CT. It's very simple to understand. It shows us what's high activity, what is too low, and what areas might be working too hard in the brain. Now, why did we decide to use SPECT imaging in our practice at the Amen clinics? Well, for me, it changes the questions that I ask. It helps me be a better doctor. For example, if someone comes in, they may not have mentioned anger problems, irritability. People typically don't talk about that, unless their spouse is there, and then they'll tell me. But if we see lowered temporal lobe activity, a certain part of the brain is low, then I might think to ask them, okay, you ever have irritable or anger moods? They'll say, yeah, actually I do. So we evaluated this so we did a study, 109 charts, and we had the doctors come up with their assessment and treatment plan, and then added SPECT imaging. And that changed what they did 79% of the time. So that was our study. This was done by a researcher at the University of Washington that worked with dementia patients. Same outcome. SPECT confirmed, clarified, or contradicted the initial diagnosis in over 80% of patients. So it changed, even if it only confirmed the diagnosis, it was helpful for patients and family members to see what was going on. It helped to destigmatize their illness. Now this is Dr. Tarswell. He's a nuclear medicine doctor in Canada, and he and Dr. Raggi from UCLA did a study on brain injury on SPECT imaging. They found that 99% of the 300 review articles picked up brain injury where a CT or MRI had missed. 99%. It's amazing. And the SPECT images were consistent with neurological and neuropsychological findings, so they were accurate. And 95% of the articles changed what they did with patients, kind of like what we said for the other two studies. I'd like to tell you about Natasha. When she was 22 and she came through our doors, more like she was drugged through our doors by her mother. She didn't really want to come. And 2 years prior, she had been a passenger in a car. They were driving down the road. There was ice and they swerved. She wasn't wearing a seatbelt and she was flung from the car and suffered a brain injury. She woke up at Harborview Medical Center in Seattle 9 days later. And one of the everyday miracles was performed there. She survived and underwent 8 weeks of rehabilitation, considered basically recovered, and left the treatment center. However, something was different. She was angrier than she used to be, and she was looking at her iPhone trying to figure out something and got frustrated and threw it, and it smashed the television screen. She had more memory problems. She was reading. She loved psychology. She wanted to be a psychologist. She would read, and she couldn't remember. She had to keep rereading 7 times till she finally was able to remember. And so when we showed her scans, and I've circled, so what we're looking at here on the right, or on the left side for you, we're looking at the underside of the brain. The top of the screen is the top of the brain, the bottom is the bottom side. And the upper left circle is a hole in her frontal lobe, meaning she may have more difficulty with impulse control, with problems focusing and concentrating. And the circle there to the right is her temporal lobe, which looks like it's been folded a little. And left temporal lobe problems in particular are associated with irritability and anger moods, as well as memory problems. And when she saw her scans, she realized, okay, maybe there's not something wrong with me, but I've got a brain injury that can be healed, and she was ready for treatment. She was afraid that maybe her mom thought she was lazy, wasn't trying hard enough. So what did we do for Natasha? Well, first of all, she didn't eat breakfast, typically. So we had her eat breakfast because our brains are hungry organs. It's one of our most metabolically active organs, and our brain actually uses 20 to 30% of the calories in your diet. 20 to 30% right to your brain. So as she didn't eat, overnight when she's sleeping, and then you wake up in the morning, she's skipping breakfast, of course she's going to have difficulty in school. We also gave her 3 stimulating herbs, Panax, ginseng, rhodiola, and ashwagandha. Because with brain injury, the brain is sleepy, and so it's going to shut off after trying to pay attention for long periods of time. And so these herbs actually helped her improve her focus quite considerably. Can a ketogenic diet help with brain injury? A ketogenic diet, who has heard of Atkins before? The Atkins diet. It's basically meat, eggs, cream, bacon, no carbs. And the brain is a hybrid organ. And it can burn glucose or fatty acids for fuel. And when it burns fatty acids are turned into ketone bodies. These ketone bodies are 3 times more metabolically active than a molecule of glucose. 3 to 1 ketones to glucose. So imagine this being the perfect diet for a brain injury patient with low metabolic brain state. The glucose transporter is damaged with brain injury. Simply, it's more difficult to transport nutrition into the brain. So these ketones just can pass right into the brain cells through osmosis. They don't have to be transported. So that's another advantage. Enhancing this diet with coconut oil or MCT oil, your liver produces ketones directly from coconut oil or medium chain triglyceride oil. So you don't have to do the Atkins. It's not my favorite diet. There's too much meat. But a modified ketogenic diet, which is more high vegetables and then meat throughout the day, or protein sources, and then higher fats, lower carb. They've done a study in particular on pediatric patients with brain injury, and this really helps in their recovery as far as energy, decreased mortality, and death. Any questions about nutrition and brain injury? Yes?
Can you go over those ones, you went too fast, about the ones that you should take, the minerals, or those 3 that you should take?
The herbs? The stimulating herbs, yes, of course. The question is, remind me of those 3 stimulating herbs: Panax, ginseng, rhodiola, and ashwagandha. These help you adapt to stress, as well as are stimulating to the frontal lobe. We also use these herbs for ADD or ADHD.
Would your recommendation be that you be in the care of a naturopathic physician before you can?
Yeah, I would. The question is, should I just go out and take these? You definitely want to talk with your doctor, your naturopathic doctor, or your chiropractor or your MD about taking these herbs, because some of the ones that I talked about earlier, like the high dose fish oil, can actually thin the blood a little bit and decrease risk of stroke, which is good. But if you thin the blood too much, say you're on a blood thinner, that could be dangerous. Question in the back.
Yeah, on the previous slide you mentioned L-carnitine.
Yes, carnitine.
Would you also, I've seen that in conjunction with CoQ10. Do you have anything to say about that?
The question is about CoQ10 as well as acetyl L-carnitine. It's another one. I could talk all day about the different nutrients, and CoQ10 is another energizing nutrient. You think about it typically for the heart. Well, that's your second most metabolically active organ. So a lot of these treatments are good for heart disease as well as for brain disease. Yeah, it's good. At the Amen Clinics, we use SPECT imaging to help assess. We use laboratory testing. For example, if your thyroid's low, none of the treatments we give you are going to be effective if you've got low thyroid, for example. We do genetic testing. That's becoming, I think eventually everyone's going to have genetic testing when they go and see the doctor, because it helps us understand what's going on. It doesn't tell us for sure that you're going to get a disease, but it helps us know if you have risk factors, for example. There's one gene in particular that I'm excited about called MTHFR. MTHFR is your folic acid gene. And if people have this, you don't metabolize folic acid to the active form methylfolate, which makes it harder to make neurotransmitters. So there's going to be susceptibility to depression, anxiety, focusing problems. So we do genetic testing, we do lab testing, we do SPECT imaging. We look at psychological factors. We ask you about your relationships because those matter. We ask you about spirituality. This is what gives you purpose in life. So as a naturopathic doctor, I love this. I mean, it fits right in with treating the whole person, looking at the cause, using least toxic, most effective treatments. We do use medications as needed, but more after we've tried other things. These are many of the symptoms classically that you see with brain injury, in addition to the balance problems that were talked about earlier. Decreased focus, memory problems, irritability. But sometimes there are symptoms that we don't typically think of as being related to brain injury. This is Peter. He's 48 now. And when he was in second grade, he was pushed off the monkey bars and fell on his head, knocked unconscious. When he woke up, all of the kids were looking at him, and the recess lady was looking down at him. He didn't know where he was. He's disoriented. When he kind of came to, he continued on. But shortly after that, he started feeling like he just had the need to wash his hands. He just needed to wash his hands all the time. And if he didn't wash his hands, something bad was going to happen to his family or his loved ones. And so he also had this obsessive thought that if he had immoral thoughts, then something bad was going to happen to his family. So he was diagnosed with obsessive compulsive disorder shortly after his brain injury. He outgrew the hand washing, but continued to struggle when he came to see us with the immoral thoughts. And these were really struggling. These were really causing a lot of difficulty for him, as you can imagine. It's clear that he's had a brain injury, and we were able to help him reduce his anxiety using some natural methods such as magnesium. So magnesium is a mineral. Americans are deficient in magnesium. 60% of Americans are deficient in magnesium. And so high doses of magnesium are calming to the brain and to the body. And it reduced his anxiety from an 8 out of 10 to a 4 out of 10. And helped him.
What dosage? You said high dose?
I'll dose 800 to 1,000 milligrams of magnesium. With magnesium, you've heard of milk of magnesia. That's for constipation. That's a type of magnesium, but it's not well absorbed, and that's why it causes diarrhea if taken in high doses. There's different kinds of magnesium that are more absorbed and go more into the brain, such as magnesium citrate. Magnesium glycinate is even better, spelled Glycinate. Thank you. Challenge me. Glycinate. You're just testing me, that's right. That's good. Challenge my brain a little bit.
When I took it, if you take too much, you get diarrhea.
So the comment is, if I took too much, I got diarrhea. That's right. So sometimes you have
Go to sleep, because calm means go to sleep.
Right. There's even a product called Natural Calm. It's a powder. And if you take too much, it'll cause diarrhea. So I'll encourage patients to start on a little bit. And as you tolerate it, increase it. every couple days until you can tolerate more, or try a different kind, because magnesium citrate is better absorbed than other forms, but glycinate is better than that, and there's a newer one called magnesium threonate, which